Hi, this is Ernie from Samson Medical. Today, I'm going to take you guys through how to set up what we call the ENT Mest Kit, which is the part of the 24K fat grafting system, specifically designed more for the ENT surgeons who do laryngology, for example, and using fat grafting and using fat for vocal fold augmentation. So this is the kit here. When you see the kit, it will come with these two boxes, the Adenizer Mixed Kit, Smart Kit Basic, also a single-use liposuction cannula, and it will also come with two 20mm syringes. So that all comes together as part of the ENT, what we call the ENT Mest Kit, or the 20mm Mest Kit. So this is used mostly by the ENTs at the moment for, like I said, vocal fold restoration or augmentation. So inside this box, I'll quickly open it and show you the adenizers are what's used to cut up the fat, to make them smaller, finer, smoother, and turn it from sort of harvested chunky fat into up to a nano fat size. So this is 4,000 micron, 2,400 micron, 1,200 micron, 600 micron, which is usually the two sizes. 1,200, 600 are usually the two sizes that we would use in terms of vocal fold augmentation or restoration. And this is the actual harvesting kit. So these are your consumables. So you can see they come sterile, ready to go, and you just need to check the expiry date on them before you open them. So this is the kit here that I've got the equivalent open versions here, and I'll show you to demo how we put it together. But these are the two boxes of consumables, of course, along with the two 20mm syringes and your single-use harvesting cannula. So this is the only reusable item. So this is part of your instrument that'll be in the tray, and it is the Smart Lock Mini, which we'll see how it goes all together. So once you've opened up your Smart Kit basic box, you're going to have the following items. You're going to have two of these little pistons. You're going to have two Luer Lock, standard Luer Lock caps or bungs for the 20mm Luer Lock syringes. And then you're also going to have a Luer Lock to Luer Lock adapter to transfer fat from one syringe to another. You're going to have a plastic plunger with a special connector or a screw tip that is designed to go into the little piston here. Okay, so the Smart Lock Mini is also designed to do that. So when it's all opened, first thing to do is grab your piston and just hand tight. So don't over tighten this because eventually you're going to have to take it off. So just hand tight, put it onto the Smart Lock itself. I normally like to pull the locking mechanism all the way up. Then grab your 20mm syringe, obviously pull the standard plunger that is in the syringe already. Pull out the plunger and just throw it away, you won't need it again. So then once that's gone, put the piston and your Smart Lock, insert that in. Okay, it's going to be a bit of a tight fit. Push it all the way down till you can't go anymore, and then lock by turning 90 degrees. So you can see the flange there is locked on now, but normally you turn it so that it can lock itself, right? So when you lock it, also recommend you locking it so that the button is on the same side as the marking. So once you've put that, the last thing to put on is the cannula. I've just got in a cannula here. So this is a standard Luer Lock cannula. Now this is ready to hand over to the surgeon. So once you hand it over to the surgeon, all they'll simply do is make an incision in the patient and insert the cannula about halfway. Once they do that, then it's time to create the suction or the negative pressure. And all they have to simply do is pull and pull all the way back. This has got a one-way lock. You can see I can't push it down. In order to push the plunger, I have to push the button at the same time. And so hence that's why we always recommend having the markers or the markings on the same side as the button so they can kind of see, you know, what they're pushing, how much volume they've got, etc. So remember, pull the plunger, no need to push the button. When you push the plunger, you need to push the button. All right, so once the surgeon's harvested 20 cc's of fat, okay, or thereabouts, we recommend 20 cc, then they hand it back to you, and that's pretty much full. So all you got to do is reverse it, take your cannula off, and then first thing to do is put the little cap or the bung on so you don't lose anything. Again, only put this on hand tight because the centrifuge will tighten it as it's spinning. The centrifugal force will tighten that. Just hand tight. Then all you got to do from here on is just loosen the plunger from the end. And this is where before when we talked about just doing it hand tight, because if you do it too tight, you're going to struggle to actually loosen it. So once you've loosened it, you can see I can kind of pull it back a little bit. And once it's loose, you just turn it, unlock it, and you can now pull that off. Okay, so that's, you can go back down in your tray. And this syringe filled with harvested fat or lipoaspirate is now ready to go into your centrifuge for centrifugation. Now to balance the other side, and this is why this system comes with two 20 ml syringes. What you do is you then open the second one and do the same thing. Okay, take out the plunger completely and you can throw that away. Then that's where the second piston and this comes in. So all you got to do is put this into the syringe, tighten the plunger, push it all the way down, and then fill this second syringe with saline. This is your balancing syringe. So however much volume you've got in terms of fat on one of your syringes, just simply fill the equivalent amount of saline with your other or with your second balancing syringe so that they end up weighing the same, and you put them opposite each other or diagonally opposite each other when they're spinning in the centrifuge, and that way they will stay balanced. So once you've filled it up with saline, obviously put the cap on, put the bung on, undo this, and now you've got one filled with fat, one filled with saline. You put them in to balance each other when they're spinning in the centrifuge. All right, so after they've spun in the centrifuge, you remove this. You will generally see there's three distinct layers. You will have your tumescent, blood, any waste material. You'll have the bulk of it being fat in the middle, and then you will have a layer of oil. Now, how much oil will depend on the patient, but you'll have a layer of oil. How do we get rid of the oil? So the easiest thing to do, grab the cannula that you used before and just put the tip of the cannula onto the edge of that piston inside the syringe, and then just push. And the oil will come through that piston automatically. All you got to do is just push the piston down. Just push it on one edge and just push. It's very easy to push. Now, once you push all the oil out, don't worry about the fat. The fat's not going to come through, just the oil. So push through all the oil and pour it out. And now you're going to have a layer of fat, and then you're going to have some blood and tumescent to get rid of. Once you do that, put your plastic plunger back in, undo your cap, put it over your waste kidney dish or pot again, and then just squeeze out all of the waste material until you're left with the pure fat. This is then where the low lock to low lock adapter comes in, and then you can now put another empty syringe on the other side, 10 ml, 5 ml, whatever you want, and then transfer all the fat into that syringe so you're now ready for adenizing. Okay, so we recommend pushing all the fat into a 10 ml syringe for adenizing, and this is where the adenizer kit then comes in. So what you will be most likely doing, you'll start with the 4000, which is the red dots, then you'll go down the 2400, which is the orange dots, and then 1200 at yellow and 600 at green. So microfat, nanofat is the 600, microfat slightly larger at 1200. So depending on what the surgeon wants, and depending on what the surgeon needs, you'll either be doing 1200 or 600. So in other words, you will have to start with the 4000. So here is an example. So imagine this is your 10 ml syringe with the fat in it. So this is your adenizer, 4000. That's one we start with, 4000 micron, which is a large one, cuts up all your fibrous tissue and things like that. So put the side with the two color dots on the side with the fat, put an empty one, make sure there's no air gaps. Push that through, attach it securely, and now you can do it 5 times. 1, 2, 3, 4, and 5. Just consistently and smoothly, not too fast, not too slow. Now you've done that one, you can grab the 2400, repeat the same thing, 1200, repeat the same thing. And so if 1200 is what you need to get down to, then from there, whatever you're left with, depending on the fat transfer gun or whatever the surgeon would like to use. You're probably going to have to transfer some of this fat into, say, a 1 ml syringe or into a Bruning's gun or whatever they want to use. Or if you need to cut it down to 600, then you cut it down to 600. And then once that's transferred, it's ready for re-injection into the patient. So this is, in summary again, this is your only reusable, re-sterilizable tool or instrument. So that will be in your tray. Everything else, generally speaking, will be all consumables. And this is how the kit comes. Everything will be supplied when you order this kit from us for vocal fold restoration and augmentation using the patient's own body fat. Thank you.